You've probably had a headache, right? I mean, pretty much everyone has. It's one of the most common things we deal with. But here's the thing. Just saying you have a headache is kind of like saying you have a pet. It doesn't really tell you if you're dealing with a goldfish or a Rottweiler. The reality is way more complex, and honestly, pretty fascinating. So that brings us to the big question. How can one person's dull, nagging ache that goes on for days, and another person's sudden, blindingly painful attack, how can they both get slapped with the same simple label, headache? That's exactly what we're going to unpack here. To really get a feel for this, let's look at two totally different experiences. Picture this. First, you've got this feeling of a tight band squeezing your head, and it just lingers. Then, on the complete other end of the spectrum, you have a pain so sharp, so focused, people describe it as feeling like an ice pick in their eye. These two scenarios are going to be the main characters of our story. All right, let's start with our first character, that tight band feeling. This is the experience of the most common headache on the entire planet, the tension-type headache, or TTH for short. Seriously, if you've ever had a headache, chances are this is the one you've met. Okay, the definition here might look a little clinical, but the key words are super important. First, it's bilateral. That means it's on both sides of your head. Second, the pain is a pressing or tightening feeling, not a pulsing or throbbing one. And this last part is crucial. It's not made worse by routine physical activity. You feel pretty lousy for sure, but you can usually keep going with your day. So what's actually going on in the body? Well, a huge clue for doctors is something called pericranial tenderness. That's just a fancy way of saying that the muscles around your scalp and neck are literally tender if you press on them. It's often caused by sustained muscle contraction, from stress or hunching over a desk all day. Now, for people who get these headaches all the time, something else starts to happen. All those pain signals coming from the tense muscles can basically put the central nervous system on high alert. It's a process called central sensitization. Think of it like your brain's fire alarm getting stuck in the on position. Your whole system becomes more sensitive, which lowers your pain threshold and, you guessed it, makes headaches happen even more often. Okay, let's switch gears and turn to our second character, the ice pick. And right away, the whole mood changes. We're now talking about the cluster headache, or CH. The pain is so severe, so beyond what most of us can imagine, that it's sometimes called the suicide headache. This is not just another headache. It's a completely different beast. The definition tells you everything you need to know. Unlike TTH, this pain is described as excruciating, and it's strictly unilateral. It is always on one side of the head, usually around the eye. But the dead giveaway, the thing that truly separates it from everything else, are the autonomic symptoms, and that overwhelming urge to move. So where on earth does this level of pain come from? Well, the investigation starts deep in the brain, with hypothalamic dysfunction. The hypothalamus is like your body's master clock. It manages your sleep-wake cycles and other circadian rhythms. With cluster headaches, that clock goes haywire, and that's why the attacks can have this bizarre clockwork-like precision, happening at the same time day after day. So, the faulty clock in the hypothalamus starts the fire. And what it triggers is something called the trigeminal autonomic reflex. Basically, it activates the big nerve that handles sensation in your face, the trigeminal nerve, and that sets off a powerful, involuntary chain reaction in your autonomic nervous system. This reflex is the source of all the strange physical signs that come with the pain. And here's exactly what that reflex looks like in practice. Remember, these all happen on the same side as the pain. You get tearing from the eye, a bloodshot red eye, a stuffy or runny nose, a swollen eyelid, a drooping eyelid, and even a pupil that gets smaller. These aren't just random symptoms. They're the core, telltale signs of a cluster headache attack. Okay, so we've met our two very, very different headaches. Now for the main event. Let's put them side by side and make the distinctions absolutely crystal clear. This is where a definitive diagnosis really takes shape. This table really says it all, doesn't it? Let's just run down the list. Pain quality, pressing versus excruciating. Location, both sides versus one side. Duration, a TTH can last for days while a CH attack is over in minutes. And the mechanisms couldn't be more different. TTH is about muscle tenderness and a sensitized nervous system. CH is driven by a malfunctioning hypothalamus. They are fundamentally different conditions.
This chart really drives home the difference in timing. A tension-type headache can be a marathon, lingering for hours, sometimes even a whole week. A cluster headache attack, for all its horror, is a brutal sprint. It can be as short as 15 minutes and is almost always over within 3 hours, only to maybe come back again later that same day.
And think about how this affects a person's behavior. Someone with a TTH, while feeling awful, can often power through their day, but someone in the middle of a cluster attack cannot sit still. The pain literally drives them to their feet. They're often pacing the room, rocking back and forth, completely unable to find any relief.
So why do we need to be so nitpicky about all these differences? Why does it matter so much? It's simple, really. Because getting the diagnosis right is the only way to get the treatment right. And as you're about to see, the treatments are from different planets.
It's a really clear, logical flow. You start by describing the precise symptoms. Is it a tight band, or is it an ice pick with a runny nose? That leads to an accurate diagnosis. And only then can you get to the most important step, a targeted treatment that is actually going to work.
And just look at how different those treatments are. For a tension-type headache, simple over-the-counter pain relievers like ibuprofen can often do the job. For a cluster headache, an ibuprofen might as well be a sugar pill. The first-line treatments are things like breathing pure, high-flow oxygen or specific fast-acting injections. Giving one person's medicine to the other is completely useless.
So all of this really brings us to a final thought. We use a simple word like headache, but as we've seen, two of its most famous forms are running on completely different operating systems. It really makes you wonder, doesn't it? What other simple conditions that we tend to just lump together are actually way more distinct and way more complex? Right below the surface,